The healthcare conundrum as we know it today is certainly no stranger to the global stage. In fact, the problem with healthcare, or the problems associated with healthcare, can almost be put into three buckets. On one hand, you have, and in the first bucket, the increasing incidence of chronic disease, which represent an overwhelming portion of the cost associated with healthcare, nearly 70% globally. At the second point, you have what we would call evolution of healthcare systems that are shifting, if you would, from pay for services versus pay for value. Can you actually incent the healthcare system to be remunerated based on the delivery of value, not just seeing a patient? There are clearly challenges associated with that, because what a patient does on their own when they're not with their healthcare provider clearly isn't a function of what the healthcare provider can control. So in and of itself, there lies in kind of a sub-level conundrum. And then thirdly, when you start to think about today how we manage healthcare through the pharmaceutical industry, we think about new drugs, new innovations, etc. But in many ways, med adherence is abysmal today. That's a well-known and established published fact, as well as the fact that when a new drug is introduced to the market, the speed by which generics then come to the market is actually quite rapid. And so you have what they call patent cliffs. So you have these three macro forces converging to exacerbate, if you would, the delivery of quality healthcare in a manner that's accessible to people around the world and affordable. So enter stage left this thing called mobility. In fact, last year, for the first time in mankind's history, there were more cell phones on the planet than toothbrushes and toilets, Economist statistic. And cellular technology knows no socio-economic boundaries. The richest of the rich have it, the poorest of the poor have it. The literate have it, those who are uneducated have it as well. So here is a technology that has managed to transgress all the norms and boundaries in society, and we ask a very simple question. How can we harness the value of that platform at a global level? So in many ways, the answer lies in a couple of key, if you would, development design principles around digital health. And the first is, these solutions have to be first clinically optimized, if you would, for the country of choice. The way they practice diabetes in the United States and diabetes management may quite differ from how they do that in India with Ayurveda and China, for example, with traditional Chinese medicine. But these solutions have to support, if you would, clinical customization in that specific country. Secondly, there has to be cultural optimization of these solutions. And cultural means not just language, it may mean tonality. The way a woman is addressed in the Middle East is very different than the way a woman may be addressed in the Western world. And we have to take into account those cultural nuances to make these solutions not just introducible to society, but things that can be sustained on a go-forward basis. Thirdly, we have to think about the content that's then delivered to these people. We start to think about the differences in food habits for the Latino community, for the African American community, for the Asian community. We have to be able to integrate and pull in content that's relevant to those subpopulations. And lastly, we have to think about overall, from a security architecture perspective, how do we do these in a manner that's scalable, securable, reliable, but that, if you would, respect the privacy and security laws of different nations. Here in the United States, of course, we have Patriot Act that prevents us in many ways from sending protected health information across the boundaries of countries. So when you step back from those four factors and you look at this disruptive thing called digital health that sits on mobile internet device platforms, in many ways, you're extending that concept that people have been talking about for decades called the digital divide. But you're now bridging that digital divide. You're bridging it using this accessible common technology, but with solutions that are culturally fit, that are technologically fit and securably fit, that are clinically fit for a given nation, for a subpopulation. And then within those countries, these platforms can then be extended to accommodate multiple chronic conditions, be it diabetes or hypertension or mental health or oncology or others. And in many ways, whilst you have this conundrum, in many ways digital health offers a very valuable solution to that conundrum.